Hey everyone, welcome to the Hormone Genius Podcast. I'm so excited because today I'm going to be asking Teresa some questions. So she is a women's health nurse practitioner. And so as a NAPRO trained medical provider and as a women's health nurse practitioner, she has plenty of knowledge in that mind of hers. I am fascinated by all that she knows. And so just like you, I love to learn from Teresa. And so I'm going to be asking Teresa some common questions about the period. So if any of you have questions about your own period, and maybe I'm asking questions to Teresa and you're like, hey, you missed one, or I have a question and I'm having a really hard time finding an answer, please reach out to us. You can Facebook message us on our Hormone Genius Facebook page. And that would probably be the easiest way to get a hold of us to ask your questions, because we want to serve you and really answer, again, those quandaries. So, Teresa.
Jamie.
How are you?
Good.
Are you ready?
I'm ready. I'm excited.
Okay. So just for everybody's knowledge, we did not prepare beforehand. So she doesn't know what I'm going to ask her. So that's the fun of this. Okay. It's the fun of this. All right. So Teresa, what would you say is a textbook period?
Okay.
Textbook period. We'll start there.
Okay. Textbook period. Okay. So textbook period is 28 to 30 days in terms of length from period to period. The period itself lasts for 4 to 6 days. It has at least a moderate to a heavy flow, and it has a couple light days in it. It's red bleeding, not any other color. It's just all red. In the cycle after the bleeding, basically the woman usually feels kind of dry. There's nothing going on. And then when she hits the middle of the cycle, she's going to have that ovulation event, the main event of the cycle, and she's going to have mucus that starts to flow because of estrogen. And that mucus is going to build up over a few days, on average for about 5 days. And it's going to eventually look clear and stretchy. It'll be able to stretch an inch or more. It's crystal clear in color like egg whites, and it feels wet and slippery. That's a normal mucus cycle, and that tells us that that egg or that ovulation happens. After ovulation, you have a part of the cycle we call the luteal phase, and that is always super stable. It's about 12 to 14 days on average, and that will end the cycle and you'll be dry again. So there won't be that cervical mucus anymore. And then your next period starts. So that is about the quickest version of a normal cycle. I would say that most women don't realize that that on average, like we always thought that you ovulate on day 14. That's a common myth, that only about 14 to 15% of women on average will ovulate on day 14. So ovulation moves, it's variable. And this is important for all women to know, because obviously that affects your fertility, but it also affects when your next period is going to start as well.
Awesome. Thank you, Teresa. Okay, so what if I'm experiencing clots when I'm menstruating? What does a clots mean, and when is it a sign that I need to go to a doctor?
Sure. So some amount of small clotting may be normal. And it also, with clots, a lot of women aren't, understanding what a clot is versus sometimes the uterine tissue. So clots, if you touched it, it would basically like dissolve in your fingers. It would just dissipate and turn back to blood. And tissue, if you touched it and held it in your fingers, is going to stay tissue. So again, a clot. And so sometimes women are looking at something that's actually uterine tissue and they're thinking it's a clot, and it's not a clot. So in a normal period, when you get up to that heavier flow, a small amount of tissue that is seen as kind of a dark kind of red, kind of, again, fleshy looking stuff that comes out, and a small amount of clots, meaning, less than the size of a quarter. And again, they're gelatinous, like, is normal with the period. What's abnormal is when the period becomes so heavy. So let's say you're changing a pad or a tampon now every 1 hour or 2 hours or more frequent than that. And all of a sudden the bleeding's kind of gotten out of control, you could say. It's like the body's trying to release that lining and it's creating this inflammation to do that. And all of a sudden it's like rolling ball that you can't stop. And so the bleeding just gets going. And that's what causes that clotting to happen. Because the body's like, this seems like it's going too fast. The ball is rolling too fast. And so it's trying to clot that blood. And when it gets to the point where you're, producing larger clots greater than a size of a quarter, and they're coming frequently, then that may be a sign that you have something called menorrhagia, or heavy menstrual flow. And that is something that could be abnormal. It could be a sign of hormonal issues. It could be a sign of something called fibroid tumors. Fibroids are benign tumors that grow in the uterus and are super common as women get older, and they can cause heavy periods with clots. Now, one tip that a lot of women don't know about heavier periods and sometimes with clots, I'll give you one natural and one over the counter, not natural, but fish oil actually helps the body resolve clots. So sometimes if I have someone who tells me that they have clottier periods, but it's not too heavy, I know it's still normal within the normal parameters, I'll have them take 2 grams of fish oil or 2,000 milligrams of fish oil every night. And that seems to help with just kind of keeping that blood flow natural and nice. And then an over-the-counter option would be ibuprofen. And people think, oh, but why would ibuprofen help? Doesn't that make your blood like go faster? Like it thins the blood. They think you'd bleed more. But actually, ibuprofen actually stops bleeding at the higher dosages. So if you take 600 to 800 milligrams of ibuprofen, which is 3 and 4 tablets of what's sold over the counter, you can actually reduce your flow by 30%. So women don't realize that they can almost kind of keep that ball, like I said, from rolling too fast just by controlling some of the inflammatory chemicals that are produced with the period.
I just learned so much. Teresa, that was awesome. I really had no idea about the difference between the endometrial tissue and clot. I'm so glad you said that. So just to, again, kind of revisit that. So a clot is something where if you touch it, it kind of becomes blood again. Mm-hmm. So it's not like the gelatin kind of like entity, like the physical tissue like thing. That's the endometrial tissue.
Right. Yeah. I mean, I call clots more gelatinous because kind of like Jello, like again, if you touch Jello enough, it would become watery, right?
Sure.
But a fleshy tissue just is going to stay fleshy as much as you touch it.
Got it. Okay. That is such an awesome visual. Thank you for that. Wow. Super helpful. Okay. So in terms of the period, when we talk about, the heavy flow, you had said if it's extremely heavy, you're maybe changing your tampon or pad, once every 1 or 2 hours, or maybe even more. And then would you call that unhealthy, or not unhealthy, but abnormal? Or what does a normal heavy flow look like as compared to an abnormal heavy flow?
Right. And it's different for every individual woman, obviously. And it's actually sometimes hard to quantify, right? Because if you say, oh, I have a really heavy period, and the girl next door may say, I have a really heavy period, and we actually measured those 2 periods, I mean, they could be drastically different because heaviness is a subjective word to some degree. Even if I can say I change my pad 3 times a day, let's say, well, did you let the pad get fully soaked till it's like so heavy with blood that you had to change it? Or was it just like barely soaked because you don't like to have, you change it more frequently? Mm-hmm. So, in saying that, there's just a lot of subjectiveness with it. But we know that if a woman is in the bathroom and she's like soaking a pad every couple hours or less, that she's probably producing greater than, that the average menstrual flow loss is about 10 cc's up to 80 cc's. That's kind of the parameters. And again, it's kind of hard to measure, but a cc is the same as a milliliter. If she's in the bathroom every 2 hours, pretty much soaking a pad or a tampon, she's really getting over that 80 mils or 80 cc's of blood. And that is where the true diagnosis of heavy menstrual flow happens. And again, just simple ibuprofen in that higher dose could be the answer for a lot of women suffering from that. But if it's to the point where they're becoming tired, dizzy, lightheaded, and so they're exhibiting signs of anemia, iron deficiency anemia, or true anemia from blood loss, then that really needs to be investigated. And again, there could be underlying organic or physical causes, or I find that sometimes just as women get into their 40s, it's like the uterus is a muscle, right? The uterus is a muscle as an organ, and the uterus just doesn't it's like a weaker muscle. Maybe it's had babies and it just isn't exercised as much in the right way. So it's now that muscle just doesn't work as effectively. And so that can cause sometimes this excessive bleeding in the 40s as we head towards menopause. And so some women end up having hysterectomies because they really have difficulty in controlling that heavy bleeding. It becomes a situation where they have to miss work because they literally have to stay home. The bleeding is so out of control. So that's not an uncommon situation that we see as the problem. What I have found is that you don't need to have a hysterectomy in the vast majority of cases. If you can just help the body through either medication or progesterone, we use so much beautiful progesterone that you can usually get those cycles kind of back to that healthy bleeding again.
Wonderful. That's such good information. Okay. Very, very helpful. Thank you. All right. Now tell us about brown bleeding. So brown bleeding, what does brown bleeding indicate? Both before the full period, at the end of the full period? We'll start there.
Yeah. Brown bleeding. Okay. So, I mean, to some degree, there may be a normal brown. Like, I'm not going to say that all brown seen in the period is bad, because maybe one day at the end of the period is normal. But once we get beyond one day of brown bleeding at the end, and we start having like 2, 3, 4, even 5 days of spotting that's brown, that's definitely a sign that there is some sort of, abnormality occurring. We oftentimes think hormones first, right? Because the hormones are what are keeping the cycle healthy and the bleeding normal and flowing routinely. But it could be, again, something not hormonal. It could be a polyp in the uterus, or an organic issue like an infection even actually can cause brown bleeding. So, but we do know that once you're beyond one day of brown bleeding at the end of the period, we have to at least consider that could be a subtle and underlying issue and could be investigated by a doctor that's trained in naprotechnology or trained in reading cycles this way. Now, on the other end of the period, so premenstrual bleeding with the period, that could be brown or it could be red. But if you have more than 2 days of spotting before your flow gets going to that medium, heavier flow, we also know that is potentially associated with a hormonal deficiency like progesterone or estrogen. And so that's something, again, just in women charting, they can be like, oh, why am I spotting for 3 days before my period? Maybe I have a progesterone deficiency. Why do I have PMS, by the way, too? And that my PMS seems to be super ragey, So it might be like, oh, I'm noticing the bleeding, but I'm also noticing that my hormones actually are making me feel crazy. And so you can put the 2 and 2 together and realize, oh, I actually should be tested and see if my hormones are not working right.
Totally. Super helpful. You had mentioned fibroids and then you'd mentioned polyps. What's the difference between the two?
Great. So fibroids, again, they're more common as we get older as women. So by the time a woman, I believe, is in her 40s, about, I want to say 40 to even 50% of women will have some fibrous tumor in their uterus. So they're benign growths made of, again, fibrous kind of tissue that form in little balls, and they can be small balls, or you can even have them be as big as softballs or bigger. And that's when they can really cause problems. And sometimes they have to be surgically removed, but they're in general never cancerous. They're just benign tumors. But sometimes the reason we diagnose them is because a woman presents with heavy bleeding or super long periods that go on forever, or maybe they're bleeding in between their periods, and we do an ultrasound. We're like, oh, you have fibroids. Mm-hmm. And then the thing is the polyp. So the polyp, definitely different. Polyps are like, I call them skin tags. So as we get older, sometimes older people grow skin tags on their body. So a skin tag is like an overgrowth of tissue, and a polyp either in the uterus or on the cervix is an overgrowth of that type of tissue in that part of the body. And it actually kind of looks like a skin tag, but more bloody, I guess. But I mean, it's different, but it's like, it reminds me of a skin tag. It's just bloody looking. But anyway, yeah. So totally two different things, but still both of them can cause some underlying abnormal bleeding issues. Actually, polyps tend to cause bleeding sometimes right around the middle of the period.
Okay. Got it. Okay. So polyps are like little skin tag looking things. And then fibroids, are they within the tissue or they're still on they're in the tissue?
Yeah, they're actually kind of described where they are. They can be outside the uterus, in the muscle of the uterus, or even in the cavity of the uterus. And we actually define them based on their location. So yeah. And one time I had a patient that had her uterus was so full of fibroids that her uterus went all the way up to her belly button. And she looked pregnant, but she didn't know what was wrong. She just was like, I don't understand. I feel pregnant. I feel just like my belly's super bloated and all the time. And she was only like 33 or 34, but I went to press on her belly and I'm like, oh, wow. So, and we did an ultrasound, and sure enough, she had so many fibroids that her uterus was the size of basically a 5-month pregnancy.
So then that would be like a surgical removal of the fibroids?
Yes. Yeah. So her situation was pretty severe. So she did end up having a hysterectomy, but sometimes like they can just remove the fibroid. It's called a myomectomy. And that would allow for the preservation of their uterus and of their fertility as well. So.
Wow. Holy moly. Okay. Another question. So what would you say is the, unknown genius for women who are experiencing their period, whether it's behaviorally or maybe just the health of having a period in the first place? Like, what benefit besides the period being a marker of not being pregnant, what other benefit does a period have for women?
Wow, that's a good question. So, I mean, I always say if you're having a period, because I think about this as my patients go into menopause, in some ways it's a sad time when you go into menopause because the period is a sign of health. Because what happens when you have a period is it tells you that all of those beautiful hormones, the genius of our hormones, we're feeding your body all month long. And that supports your brain and your heart and your bones particularly, and your endocrine system. So there's just such a symphony of health events that are occurring and being protected by our hormones. And so it's sad when women go into menopause to some degree, because what do we know about when you go into menopause? Your bones start to lose density. And so we know that that's been protected ultimately to the point where you stop your periods. Brain health changes. One of the most common symptoms of menopause is brain fog and not remembering why you walked into a bedroom, I think what people don't realize is that there is such a connectedness to our menstrual cycles and our health. And I often tell women, even in those perimenopausal years, what I want to do for them hormonally is I want to keep them a grape the longest as possible. Like, in some ways, like when you go into menopause, you're kind of shriveling up into a raisin, which no woman really wants to shrivel up into a raisin, do they? So I think of like hormones as keeping you like a plump grape and keeping you healthy. So my goal is always for every woman to look at it that way and be like, how can I optimize and keep you a grape for as long as possible? And most women appreciate that.
I love that analogy. I'm going to start using that. Holy moly. Something I was reading, I love hormonology, HORMONOLGY, hormonology. I don't know if I spelled that right. I love this woman, her name's Gabrielle Lichterman.
Yeah.
Anyway, what she shared about kind of each phase of the cycle, and we're going to talk more about this even too in future podcasts, is like the genius of the hormone genius sort of thing. But during your period, I was just reading about how, like, because the estrogen is low and the progesterone is low, it's not as noisy in a sense. So it's like, it would be a good time to discern or to pray. Obviously, we could pray every single day and journal every single day, but it's like there's clarity and intuition there, which I thought was pretty empowering emotionally. I know I'm talking to you more about physical, but I wanted to share that because it came up for me. And then also what I thought was interesting is as estrogen and progesterone decrease, our ability to understand where we're at spatially. So if I'm driving to the store and I'm on my period, I'm gonna have a better chance of or maybe a store in a different town, I'm gonna have a better chance of knowing how to get there than when my estrogen, like my female superhero hormone, is high. I thought that was a little interesting fact.
That's fascinating.
Isn't that cool?
I love that stuff. I mean, I have read, I think, a little bit of her stuff, probably not as much as you, but what I've always noticed is just in terms of that kind of genius of our hormones and how you feel is whenever I give presentations, I always am hoping it's around like the beginning of my cycle, because I notice I get much more nervous when I'm premenstrual. And there's nothing sometimes you can't change your talk to match that, but I'm always like hoping and praying my big talks are around my kind of either early part of the cycle going into ovulation, because we know when our estrogen is high, we get this like super confidence about ourselves and we feel good. Our skin looks better, our hair looks better. So we're just ready to take on the world. So I think that's so cool too. And I don't think if women knew that, at least like when I'm giving a talk and I'm premenstrual and I'm nervous, I'm like, you know what? I'm nervous because I'm premenstrual. No big deal. Like, you've got this, Teresa. You know, the awareness is just super helpful.
Totally. And I'm excited too for a future episode. Everybody be looking for it. It's going to be your hormone genius at work, where we'll be leveraging your hormones to help you understand when to schedule things. So I'm really excited about that one. So it kind of feeds into what Teresa just said, but we'll talk more about that because that is super fascinating. Cool. Okay. So let's see. I'm going to come up with maybe a couple more questions for you, Teresa. All right. So let's say a woman has reached her menopause years. Okay. So her ovaries are no longer pumping out the estrogen, and she starts to notice that she's spotting though, but she hasn't gotten her period in years, but she's noticing spotting. What might that mean?
Yeah, great question. So this is really important because once a woman hits menopause and she hasn't had her period for a whole year, so that's the definition of menopause first and foremost. You have to be a whole year without having a period to be classified as truly menopausal. But any bleeding or spotting that occurs after that point, particularly, needs to be investigated by a healthcare professional. So what are the reasons that could happen? Well, it could be that maybe she started actually a supplement over the counter because she was getting hot flashes and she started taking something like black cohosh or red clover, and it might potentially induce enough hormones that she could have some spotting. It's just one thought. The other thing is that sometimes women who are obese or have a very high BMI, they actually might have more estrogen in their body already, because we know that fat basically holds estrogen in its cells. So that puts her at risk for something called endometrial thickening, which is the lining of that uterus is just growing because of the estrogen stimulation from the obesity. So that's a risk factor. So women, weight is always important to our health. So you can remember that if you are overweight, you might have this endometrial thickening if you have some spotting, and that should again be investigated. Why is that important? Because if endometrial thickening happens and it just, let's say it lasts for a really long time, like years, it eventually could become cancerous. So many women who have bleeding in menopause, they need to have a workup, they need to have an ultrasound, look at that lining, and potentially they need a biopsy too, just to rule out cancer. And then we always need to think about, are you on any hormones? So in my practice, we use hormones in menopause to help support women's bodies. So if she starts a hormone therapy, then the chance of spotting is greater. So it might be something we monitor in the beginning. And then if it just keeps continuing, we definitely evaluate. But those are a few of the things. A polyp would be another thing that could be an issue. Maybe, again, back to the fibroid, that's a possibility. Thyroid problems too. I mean, if someone's thyroid is just really off, that is always something that could cause a disruption in the endocrine system, of course, and a disruption to the menstrual cycle, even in menopause as well.
Very good. Oh my gosh. Everybody listening to this episode is learning so much. They're going to be a genius by the end of this. Man, Teresa, you're awesome. Okay.
Love it.
A hormone genius, that is. Okay. One more question. So what can a young girl expect as she's getting her period? And what can parents know about the girl's first period, maybe within the first year? What's normal? And then what would be abnormal where the girl should go see a doctor? So tips for parents, basically.
Yeah, I know this is a great question. It comes up often with my patients and concerns about parents, and also even the birth control pill, because oftentimes girls are put on the birth control pill early on for bleeding problems. First and foremost, it's important to remember that it takes on average 4 to 6 years for the whole reproductive system to mature. So your daughter starts her period at 11, 12, 13. She's got this amount of years that it takes for all the kinks to be worked out and for the ebbs and flows of the hormones to become perfect, or what they should be normally. And in that imperfection in the beginning, there can be some cycle irregularities. So your daughter could have her first period and then not have it for 3 months. And that I wouldn't worry about, because again, what she needs to establish is a healthy ovulation, which is what causes healthy periods. And that is not happening yet, which is okay. The things that can happen is sometimes girls' periods will be different. The first one might last longer. It might last shorter. It might be 10 days, but it was kind of just spotting the whole way through, or it was really short, like 3 days, 2 or 3 days. And again, if it's at the beginning of her reproductive life, if she's not in pain, if she's not heavily bleeding, we might just say, hey, again, your body's got some kinks to work out of the system. Let's just monitor this for a while. Now, what would be abnormal that you really should address is someone who's maybe been bleeding for 3 weeks and maybe it's heavier. And you really should then address that with a physician. Now, the way I might approach it may be different than a traditional OBGYN. They may look at her situation and be like, oh, your period's not right. We'll just put you on birth control. And my approach would be like, okay, yes, your period's not right. Obviously, again, there's some, your ovulation patterns haven't been established yet. What can I do for this? And I might use progesterone, the natural hormone to the woman's body, and we can get her cycle right back in sync and get it reestablished. We do that for a month, 2 months, maybe 3 months. No birth control needed, no artificial hormones needed, and she's back to feeling good and healthy again. And I've done that with so many young girls. And I just know as a parent myself, but the mothers that come to me, they're just so grateful that we were able to, solve the issue and not have to use artificial hormones to do it.
Totally. So important. So important, because for this podcast, we want to rise a new generation of women. And, that will include women in their 20s listening right now who in the future have children and now know, into their 30s, they have a girl daughter, 11 or 12. You will know now that contraception, birth control is not going to fix a problem. And then for those of you who are mothers now currently of a young girl going through those painful cycles and those irregular cycles at the very, very beginning, what is considered normal, that 4 to 6 year time frame of kind of adjusting, and then also just what's not normal and when to go to see a doctor. So so again, there's different systems, and we're representing one of several, and there's many beautiful systems. So just hear us when we say this doesn't have to be the only way, but if you are looking for tools, we don't want to leave you with all this information but not give you like a place to find the closest doctor. So Teresa, so there's the education Pope Paul VI Institute site, and then there's also like the educator site, how to find physicians. Do you know what that website is?
Yeah. So it's fertilitycare.org. So there are physicians trained around the country that know how to practice, again, kind of in this more holistic way. And there are many of them, not all of them, but many of them are listed on this website, fertilitycare.org. And underneath the banner that says NAPRO technology, you can look for a medical consultant, put in your state in the search engine, and you will be able to see if there's a doctor that's practicing in your area like me, who again, their goal is to really look at the female body as not broken to begin with, but something we can actually really find the underlying problem and solve.
Totally. So thank you so much, Teresa. I loved all of what you taught us today. And I took some notes because I don't want to forget any of this. So be looking for more Q&As with Teresa. And again, share this podcast with your friends on social media, with people you know need to hear this message. And then also please find us on social media. And we're so thankful for you, and have an amazing day.
Thanks, Jamie.
Thanks.